I'll show this. Okay, great. So thanks so much again for kind of making for this. And what we thought we'd start with is really jumping into where can you find some credible evidence and what are some of the search tips and tricks for finding that. So as we sent out in the brief, and what we sent to you is that we wanted to look at how do you go from question to answer? How do you make your question clear? Simple rules for searching electronic databases. And then also how to search and navigate the Cochrane Library and what's in there. And I thought, I mean, because of the timing, obviously, I wanted to point you to some of the COVID-19 resources. So I hope that matches your needs too. Just want to get right. So just checking the sound. Okay. So just to jump in. So this is one of the issues that have been coming up around COVID-19, and I thought this might be a good place to start. And that is, we're all desperate to find something that works to treat COVID-19. I mean, that's the gold we're searching for. And what's been coming through in the news lately is this information about the South African National Blood Services, and they're interested in this blood plasma to treat patients with COVID-19. And as you may know, so this whole idea is that people who have been exposed to COVID-19 develop an immune response, and they develop these antibodies, and you can actually kind of get blood from them, filter it through, and extract just the plasma for kind of then using that as a treatment that you give in an injection or an IV and an intravenous line to a patient with COVID who's hospitalized, to try and prevent them from getting more ill. So basically they get this passive immunity, they get immunity from someone else, and that can be used to fight the infection in their body. So this trial that's happening in South Africa aims to work out whether the treatment can reduce death. I mean, that's the ideal, or whether it can shorten hospital stay for patients. So when I'm, as a clinician or as even just a lay person, I'm faced with this question, I need some way of unpacking the question to find out how do I find out more about, does this plasma work, this blood plasma, convalescent plasma work? So I'm sure you would have seen this floating around out there, this story. So, so the way that we unpick the question and try and make it as clear as possible is using something called the Pico Approach. Now, this is something used globally by all different kinds of role players. It was started with researchers trying to be very clear about the question that they're posing, but it's used by consumers, it's used by patients, it's used by media and other settings too, to try and unpack the question. So we try and find out what's the population, what's the intervention of interest or the experiment that's being kind of imposed on people, what's the comparison, because of course, you can't really tell if something works unless you have a comparator arm. So that's why this is so important. And then what are the outcomes that are important for you to know about? And so this is called the Pico. So the Pico is how we unpack our questions. And so I've placed this question at the top here again, and I'm going to ask you to actually unmute yourself and pitch in with me to help me find out and unpack what are the participants, the intervention, comparison, and outcome that we could unpack from this scenario that's above here. So I'm going to, so if anyone wants to, yeah, let me know who wants to put in, what are the participants that we're interested in here? Yeah, I see, I don't know if Rose's sound is working. Mia, Joan, Laura, go for it.
Yes, so obviously the recovered patients, right? For trials,
yeah, that's a good, the recovered patients, the people that will get the blood from are actually part of the intervention. They are the people whose blood we need. But it's one of the confusing bits and why I chose this question, because participants can fit in both places. So that's a good point. So who are the other patients? This is maybe the participants that will be enrolled in the trial.
So the ones who are sick, right? Who
Yeah,
need to get better.
exactly. So it's people who are proven to be infected with COVID-19. So those would be our participants. The intervention that we're interested in. So what do we want to do to these patients who have COVID-19 to see if it works?
Can I leave it to the other people?
Okay. Yeah.
So would that be blood plasma treatment?
Exactly. No, that's spot on. So blood plasma, also known as convalescent plasma. So people who are convalescing from their illness, we take their plasma, or the blood bank does anyway. And so that's why it's that kind of blood plasma from recovered patients, that convalescent plasma is the intervention. Is there a comparison in the scenario to see what it would be compared to? Oh, sorry, bird sound.
Or maybe people who maybe people who don't get the treatment. So those who get the plasma, those who don't.
Yeah, that's
because I'm assuming that.
Okay. Yeah, so you ideally in a trial setup you'd have say 100 people with COVID-19. Half of them would get convalescent plasma. The other half would get no treatment or a placebo, some other kind of drip treatment, or kind of just getting some saline drip or something. And then the outcomes we've put in here. So what do we want to see if it improves or reduces? Go for it.
To reduce the death rate?
Yeah.
And hospital stay, shorten hospital stay.
Exactly. And there might be a long list of other things, does it reduce people getting, needing a ventilator? Does it reduce how much oxygen they need? So there might be lots of other outcomes, but thank you so much. So I've kind of tried to plot it on here. The participants, the convalescent plasmas, the intervention, the peak, the C and the O. And this would be a great starting point because already you're clarifying what it is that you're looking for. And we would, in a kind of a research setting, we would put it now into a question format. So in hospitalized people with COVID-19, what are the benefits and harms of using convalescent plasma to reduce deaths and shorten hospital stay? And I guess in the outcomes, we should also have side effects and things like that, because it's not just about benefits. It's also, what is the risk benefit on how does that weigh up? So just to jump into searching tips and tricks, why do we bother clarifying the question? Because the truth is, and having done this myself many times, or a few times at least, enough times to realize that if you don't have your question very clear, it's very hard to find the answer. So it saves you a lot of time to spend time on getting your question right. So you can then conduct an effective, comprehensive, focused search. And then for those of us doing research, particularly systematic reviews, we need to do something that's credible and defensible and replicable. So we have searches that if someone else, anywhere else in the world, put in the same search, they should find the same things. And how a search starts is you identify these key concepts. So the PICO is the starting point for the key concepts. And then you create additional search terms. So for example, we've said COVID-19 on the participants, they have COVID-19, but we know that there's so many other ways of saying COVID-19 now out there that it's not always guaranteed if you're searching an electronic database that the authors of that paper would have written COVID-19. They might have used a different term. So thinking through the terms, and we'll work through this again. So it's the PICO is the starting point, then any additional terms. And then your search will start with 2 to 3 of the most important concepts. And you focus on what are you most likely to find in the title and the abstract of a medical paper, so that you're not kind of putting in too many indistinct concepts. And let me show you how that looks. So if we start off with this PICO that we've already found, we need to think of other concepts or other terms. So synonyms, basically. So under COVID-19, what are the other terms that you are all kind of working with? oh, sorry, I must admit Rosaline, she's in the lobby. So the other terms for COVID-19 that are common would be coronavirus. Any others that you're working with or familiar with?
SARS-CoV-2.
Yes, perfect. And then, I don't know, convalescent plasma would be the other one. And I've added it in. But, you know, with convalescent plasma, you can either have this quite watery soup of plasma, or you can have immunoglobulins, which is a bit more concentrated with the antibodies. So I just pulled out some of these synonyms because this is important. If you only search with COVID-19 and half the authors out there have written SARS-CoV-2, then you won't find everything you're looking for. So this is how, and I've dropped comparison and outcome because it becomes too broad, the search, and too messy. These are the key concepts: participants and intervention. Now the question is how to combine these searches, and I'm not sure. Michelle and I were wondering, you know, we were thinking none of us were ever taught Boolean operators before we came into this world. But just to recap briefly, OR is used when you want to join synonyms within one concept. So related words could be joined with an OR because it makes the search broader. It instructs the search tool to retrieve any record that contains either or both of the terms. As opposed to AND, which is used to join words or phrases that are distinct and will kind of narrow what you find. So just to give an example, so if you imagine that in these circles is all the literature, medical literature out there about COVID-19, it's been around since December as far as we know, and so this is the information that we have. Chloroquine, on the other hand, has been around for decades, treating malaria, treating rheumatological conditions, and so there's a lot more literature out there. And we're interested in COVID and chloroquine. So how would we combine that? If you were to say COVID or chloroquine in a search, you would find everything about COVID and everything about chloroquine and everything that is a combination of the two of them, and that expands your search. So ideally what you would do when combining these different terms, you would use COVID-19 and chloroquine and find the data and the evidence and the medical literature that combines them. So I hope that's a useful recap because we'll come back to that when we go into the Cochrane Library. But these search functions, they apply in Google, although most of us just put in a simple term in Google. It applies in PubMed and all of these electronic databases. Yeah. So Michelle, just let me know if anyone has a hand up or questions. So these are the key terms that we're turning from concept. So here's concept one, which is around the participants. The other concept is around the intervention. And this is how we would combine them: COVID-19 or coronavirus or SARS-CoV-2. The intervention would be these two synonyms or different terms for similar treatment, and you'd combine it with the AND. So that's a bit of the background to that. So now, maybe having looked at that scenario around convalescent plasma, looked at how we would unpack the question, what I'm going to do is escape from my presentation and hopefully jump into the Cochrane Library, which I hope you can see. So this is the landing page for the Cochrane Library. So the Cochrane Library it's an online journal of sorts. It includes several databases, but it's basically the editorial face of the Cochrane collaboration and the Cochrane organization. So the Cochrane Library, it's quite a busy landing page, but I'll just help us navigate a little bit through this. So on this pink strip over here, you'll find the three main databases: Cochrane Reviews, Trials, and Clinical Answers. So what Cochrane's most known for is the Cochrane database of systematic reviews. And again, that's like the online journal for all the reviews that are done. But they also have, which you might not know about, is a register of all trials conducted. They do systematic searches of a number of electronic databases, and they compile all the trials there. So if you're looking for trials, you could actually go here and do a search in the trials platform called Central. And then this has come about in the past few years, Clinical Answers. If you're a clinician or a person who wants to know, does this work? There's a very short, sharp answer to multiple clinical questions that is not a lot of detail, but just gives the bottom line, particularly for healthcare practitioners, I would say. So that's the pink band along the top. There's about Cochrane and the Cochrane Library, and there's a help function with some Cochrane Library training, and we've provided some links at the end of this presentation, which you may want to have a look at. So,
right, Tamara, I think Mia might have a question for you.
Okay, great. Yeah. Go ahead.
Nope, I don't actually.
Sorry, you were flashing, so I just wanted to double check. Okay, sorry to interrupt.
No, all good. I needed a breather. Good. It's very strange talking into the ether, but here we are. So the middle part of this landing page is a featured review, and it's usually a monthly featured review. I think they're cycling more rapidly through different review topics because there's so much emphasis on the coronavirus types of evidence coming through. Below that, they have highlighted reviews in the current issue. And a lot of these, again, will be related to COVID, but some are just the other reviews that are coming through. And if you scroll down further, you can browse by topic. So if you're particularly interested in infectious diseases, you could scroll through there. And it would take you to all the 774 Cochrane reviews. So this is quite a broad search. It's all the infectious diseases topics, all the protocols that are planned and ongoing, clinical answers. And you could scroll through there if that was something that you would like to do. Just to go back. Just to mention, so you can browse by topic, you can browse by a Cochrane review group. The Cochrane review group, there are about 50 Cochrane review groups. Each of them are shown below. They're kind of topic-specific groups, and they are the editorial groups for each of these topics. So each one operates as a mini journal and publishes Cochrane reviews on that specific topic. So that's also, if you're particularly interested, that's the area. So the Cochrane Library's got a massive editorial back end and an editor-in-chief and the works that kind of curates all of it. Along the right-hand side is usually topical stories, training opportunities, new changes to the database will be shared along the right-hand side. You can see it's a big COVID focus right now. And then there's the search. So finally, we get to the search that I wanted to show you. And usually I would start here and I would put in a search term over here. But because we've just chatted about the Pico, I'm going to show you the advanced search function, where it's got a number of tabs. You could do a search in here where you add in your term, but I'd like to show you a new function, which is the Pico search. So they've basically pulled out the Picos of all the Cochrane reviews in the library. And here you could enter a term. So say, let's put out a P, COVID-19. So you have to pick from the drop down. And you can already see on the right-hand side, it is suggesting, is this your population? So yes, this is part of the population. And you can add in, okay, so it's COVID or, let's put in coronavirus. There we go. And that's also the part of the P. And we want to put in convalescent plasma. And we take from the drop down. So obviously it's recognizing the terms and it's recognizing convalescent plasma as an I. And you can run the search. And it's immediately finding a review on this topic. So that's quite handy, and it's just a way that you can use the search function if you're finding too many hits and you want to get more specific. But I'm going to take us back to the simple search, and you can actually put in, so I often put in quite a simple search term, like this, convalescent plasma, or I don't overcomplicate, and you can just hit the magnifying glass and hit the search function. Yeah. And you'll see what reviews come up. So there are not many reviews on this topic. One is from 2014 on measles, so this has been used before. And here's the review that we're interested in, convalescent plasma. And I'll just click us through. We're not going to go in depth. You're welcome to ask questions, but so this is the review format, and this is in fact a rapid review. And this is quite a new product that the Cochrane Library is putting out because of the urgency of responding. This is a review, like many of the current reviews, they've all been in response and commissioned by the World Health Organization. And like any medical journal article, it starts with this long abstract, which is quite technical and explains our methods and what was found. And you may choose to go in there. What I want to point out to you, though, is that every Cochrane review has got a plain language summary. And to be honest, if I'm not familiar with the topic, this is usually where I start. It's supposed to be at a grade 7 level, and it takes you through some of the key results and main findings. So that's quite a useful starting point. And also the Cochrane review, they used to put these authors' conclusions embedded at the end of their 100 or 200 page reviews. Now they've put them up front. So you can look at implications for practice and implications for research, and often identifying what are the gaps in the research. So that's quite handy. And so that's what you would find if you put in a search for that. Also, these particularly topical reviews have got linked resources. There's a clinical answer, so short, sharp, does it work or not? Podcasts. So just click through there. So podcasts are usually just a few minutes long. It's from a lead author. And if you're more of an auditory person and you want to just listen to some of the key findings, that is a great place to go. And finally, a lot of what's been happening with Cochrane are these special collections. So there are about 6 special collections now. This is a special collection on critical care. So it's got a number of interventions around ventilators and treatments and which fluids to give and all different kinds of things. And these special collections are compilations of all the Cochrane reviews on a particular topic area. In the past, there's some fantastic collections around stopping smoking and TB diagnosis, but now basically the impetus has been around all the Cochrane reviews around COVID-19 topics. So I think that is the Cochrane Library landing page. And I think I'm just keeping an eye on the time. So hopefully that's been a useful introduction. I wanted to just show you, if you click through to this final little blue block over here, it takes you to the sister page, which is about Cochrane as an organization. So just to say, so Cochrane is, although the Cochrane Library is the database with all the reviews and all the kind of the topical content, Cochrane itself is a global independent network. It was started in the 90s by a group of, I think I could call them evidence activists. They really believe that healthcare decisions shouldn't be based on expert opinion and what you think is best and cherry picking individual studies, but that decision should be based on really good summaries of all the available evidence, a systematic review in effect. And so they started this organization, and they went, in fact, they were, I think, if not the first, amongst the first online journals. They were never, and they had a kind of a massive slide deck of kind of floppy disks back then. And but they've been online since the late 90s. And so it's just really interesting. But this side of it is the Cochrane organization, it's based in the UK. There's a UK charity, but groups like ourselves, like Cochrane South Africa, there are centers all around the world that kind of support evidence-informed decision-making in different ways. So as you land on here, you'll see there's a lot about the background, and we won't go into that. But just, I think it's worth sharing something that sets the Cochrane organization and the Cochrane Library apart from many other journals is that we do not accept any commercial or conflicted funding. There's no alcohol, tobacco funding, no pharmaceutical industry funding. You really can't lead reviews if you are conflicted in those ways. The Cochrane community won't tolerate it. So I think that is quite useful to know, in that these reviews would be highly, it keeps us independent in the information that we share. There's also a section here for the media. So media get free access to the Cochrane Library, and you can also we can help you and link you up if you'd like to receive any of the press releases, the embargoed stuff that comes through. We'd be happy to link you with that. Cochrane Library in South Africa is actually fully funded by the South African Medical Research Council. They pay for a national license so that anyone in South Africa, with a South African IP, can click through and have full access to the Cochrane Library. Last but not least, I wanted to just introduce you to the COVID-19 resources that they've been pulling together. So there's been a massive impetus in the back end to kind of really focus attention to getting coronavirus products available to those that need to make decisions as quickly as possible. Like I mentioned, there are 6 special collections. I think they're along the side here. Things like optimizing health in the home workspace, how to do telehealth, all those kinds of things. There are 4 rapid reviews that have been published, a regular review. We work in multiple languages because, again, the Cochrane community demands it, because it's as a global group. And then they have this COVID-19 study register that I'd like to show you. So this is a page, it's quite a long list of different resources that they've been compiling. So, for example, it links you with the Oxford Evidence Service. They've been doing some nice reviews. They have particular interest in working with consumer groups, so some of that is listed here. But under this section, information and resources for researchers, there's something called the COVID-19 Study Register. And it explains what it's about, but I want to actually show it to you because I think it might be useful. So the Cochrane COVID-19 Study Register, they are searching daily across multiple databases to identify any studies, either planned, so not yet started, or published, or even in the preprint field, that they're pulling together into this database. So if you're particularly interested, and I'd call it hydroxy, but I won't, chloroquine. So this will capture chloroquine and hydroxychloroquine, and you hit search. All the studies, how many? So there are 165 matching studies that are coming up. Some of these are published. Actually, very few are published. Most of them are planned and ongoing trials. And you'll see along the left-hand side here, again, they use this Pico annotation, the population intervention. So if you particularly want to click on a particular aspect, you can do that. So now you know what Pico is all about. But I think this is very useful. And the tech people behind this database are also working across a lot of different global databases. The Norwegians have a great database, the Canadians, and they're trying to see how they can streamline the work that they're doing so that there's minimal duplication in this world, in this infodemic space that we're working in. So that's what I wanted to introduce you to in a nutshell. And let me come back to this. So I hope that I've been able to just help navigate through the Cochrane Library and some of the resources there, including how to search for and find a review or topic, a review of interest. I've also just introduced the Cochrane as an organization that's a separate part of, it's the kind of the back end organization behind the Cochrane Library. And I've also listed in here some of the resources you might find useful for your work. Also to mention that Cochrane's in an official partnership, or they call it official relationship, with World Health Organization and also with Wikipedia. So you can see how important it is to make sure that the information, credible information, reaches those people that might need to use it. So thanks from me to you, and on behalf of our consortium that's represented here. I'm really, really delighted to have been able to spend some time, and I'd love to hear your questions and engage more with you about any questions you have about this presentation, but any other topics you want to talk that's related to evidence and reaching people who need to hear credible evidence. So thanks.
Tamara, it's Mia. I also would like to thank you. I was particularly grateful to learn about the grade 7 explanation section.
Yeah.
I had no idea that Cochrane makes stuff so accessible. We use Cochrane reviews a lot, but I think we often find them through Google searches and stuff. So it's very, very useful to know how useful the website is, and also the Pico outcome thing. I personally had no idea that you could do that, and find it pretty miraculous. Yeah.
I know, so did I. I'm glad. I'm glad. Yeah.
But I mean, also just to say on that, you know, the idea is a grade 7 should be able to understand it. But if you find that those plain language summaries are still not understandable, that kind of feedback would be very useful to us as well, to feedback to Cochrane.
Yes,
Yeah.
absolutely.
So I don't know if people have any questions about what's been presented, or if, I'll just pause and see if anyone else from the team wants to say anything.
Yeah, just thank you so much. I thought it was really helpful, especially the part where you guys are tracking the COVID-19 studies, because I think that's a big question that we kind of often look for, and that information is spread out all over the place. So if you can direct people to like that source and be like, knowledgeable people are putting this together, that's super helpful. So thanks so much. Yeah.
No, it's a pleasure. We're also trying to track all the information. There's some really excellent evidence maps, and obviously I didn't include them today around COVID, but it is a lot, and it's picking which one you're going to use is interesting. With my other hat, which is on the national COVID guideline writing group, but particularly on the essential medicine kind of committee, we're doing rapid reviews around all of these therapeutics to try and see what works. And we're also navigating all of these different databases. So I'm with you.
Tamara, I have a question. So what is the difference between a rapid review and a systematic review? Like, is there like a time difference, or how does it work?
Yeah, so you could do a rapid full systematic review if you had enough people to do it. But what a rapid review tries to do is cut some of the methods corners that will save you time without cutting the rigor and the quality. And how that gets done is still being refined. But for example, with a Cochrane review, you would search, as many databases as needed. Whereas for a rapid review, you might only search PubMed and Embase, or 2 databases. Instead of doing everything in duplicate, which we do for a full review, you might do it in a single person screening all of those records with a second person just checking. So there's just little corners that are cut to save time. So they're very good. They're very good products, the ones that I'm seeing here, and they've got very strict kind of methods behind them. But if you read in the literature, if you come across rapid reviews elsewhere, in fact, it's quite well known at the moment amongst colleagues working in this evidence-based healthcare space that the rapid reviews coming out globally are generally really poor quality. And even the systematic reviews coming out are generally poor quality, because people are doing these rush jobs, and it is quite tricky to know what you can believe and not. So we are, whatever we're using, we're appraising them first and checking their quality. Where did they cut corners, and does it mean we can't believe the results? And that's something, I mean, I don't want to, put my hands up, but if you ever have a paper and you're wondering, about the credibility, maybe there's someone from our team that could provide some support in appraising or things like that, if time allows for you and for us.
So in cases where we don't have access to you, so if you're just not available, what are the things that you can use to know if the thing is credible? So is it sort of like, if you haven't put it on your database, it shouldn't be used, or?
No, I wouldn't. No, there's some. So there are specific checklists, actually, appraisal checklists that you can use. And in fact, that could be a topic of a future webinar, not to go into tons of depth, but introduce you to some of the tools if you'd be interested. But for example, if you do appraisal of a trial, you could look, both Oxford and the Canadian group have really good checklists, but these are resources we could share with you. Yeah, and there's no reason that you shouldn't be doing that appraisal. That's a good point. I see Joan has a hand. Go for it.
Hi, yeah, so kind of also a question on trying to figure out what the credibility of studies is, and it's great that you. Usually, I would, whichever expert I'm talking to kind of point to help with those kind of things. But I've often in Google Scholar, the time filter, like from which year research you should be looking. Is the usually how do you, because it might be a more recent study, but it's not necessarily the best data around. Do you have any like rule of thumb when it comes to time period you should research?
I guess it depends. It's a really good question. It depends what you're trying to do. So if I'm doing a systematic review, I tend not to put any date limitations because I have to make sure I don't miss anything. If you've got a deadline, then again, if I was doing a rapid review and I needed to provide it in 1 week, I might put a date limit on it. So I might put 5 years or 10 years, depending on what the question is, because. Yeah, so I think the most important thing is that if you have looked only for the past 1 year, maybe somewhere you should say, or we would certainly say, searching from January until December 2019 or whatever, that at least there's some transparency in what you have searched and what you may have missed. At least you have a note of that yourself.
Okay. And then a second question I have on the time thing as well is impact assessment that the government did for a new law, and they had one Cochrane review from 2014, and then they had like that found that there was not enough evidence for either like for or against the alcohol advertising bans, basically. And then then they had a different review saying, which was like over 20 years, they had whether that they had looked at the how effective alcohol advertising bans are, but those 20 years, 80s. So how do you say, like, could you really? Those are the two ones that the report was focusing on.
Right.
Like, I didn't know how to evaluate if it was a fair comparison between them.
Yeah, it's an interesting one you mentioned. Well, firstly, because I was on that alcohol banning Cochrane review, and I remember it very well. Because ultimately, if you want to know if something works or not, you need to have a comparison arm. And what happened, I think I can mention this. So with that review, the studies that were done were not great quality, and they didn't quite answer the question. So we were left with the situation of, with the current evidence base, we couldn't tell one way or the other whether an alcohol ban would reduce kind of the age at which people started or kind of people wouldn't start drinking so early, they wouldn't drink as much. So we couldn't tell from that. And one of the first people who picked up this review was the alcohol industry to say, oh, look, there's no evidence that an alcohol ban, advertising ban does anything. It's very tricky.
They did it again as well.
Exactly. And so I haven't seen the other one, but I think when an area like alcohol advertising ban and a lot of the other, I mean, in COVID now, we have tons of it, is where there's uncertainty. We just don't know yet if something works or not. It lends itself to more research being done. So when an alcohol advertising ban comes in, countries should try and capture that information in a way that can be published and made available. But in the absence of that, a decision is made looking at other factors, like what would be the costs? What are some of the moral feelings around alcohol and alcohol bans? What's the feasibility of banning things? So evidence of benefits and harms, just to say, is one part of the evidence base that informs a decision. And I think we're seeing that with the MAC group as well, is that, there's evidence of what works and doesn't work, and a lot of the times now we don't know. So decisions are being based on other factors like costs, feasibility, how acceptable is this intervention or this thing that we want to introduce. So I'm not answering your question exactly, Joan, but just to say lots of factors that impact a decision, and the idea increasingly is that we make these decisions as transparent as possible.
So the reason I was looking at that study is because in responses to us, the alcohol industry was like, look at this Cochrane review, it says there's no evidence. And then to kind of balance that out, I was trying to figure out how to balance out their thing. When it's a situation where the evidence isn't strong because of there are not many countries that have. Do you have any suggestions for contextualizing that?
I think it's a great question. So it's the typical thing of absence of evidence is not the same as evidence of absence. If you can wrap your head around that. So just because there wasn't evidence, so absence of evidence. So just because there's no evidence doesn't mean that the intervention doesn't work, or the treat, or the policy, or whatever. But industry will take it and run with it in that way, potentially. So what we found in the review was that there was insufficient evidence to tell us whether or not it may or may not, an alcohol advertising ban would work, for example. And the similar case with all the COVID, a lot of the COVID data at the moment, particularly, things like chloroquine and hydroxychloroquine, there's not enough data about what works or doesn't. It means that we need more research. It doesn't mean that it doesn't work.
Okay.
Go on.
So just the last one on that thing. What I ended up doing was saying that although there's no evidence for the intervention, there's very strong evidence for the problem exists. And afterwards, I was wondering if that was like an equivalent thing that nothing to do, because there's no evidence for that, but there's like all these things showing the link between, like, how bad the problem is.
I think that's a critically important place to start, and I think you're spot on. So that is where decision makers need to start, is how big is this problem? Like, how big is this problem? What is it causing? What is it causing people's lives? What are the harms that are happening? Then you look at what the evidence shows, and we don't always have evidence, but that it doesn't mean, I think that was a smart way to tackle it.
Okay, cool.
Yeah. So maybe just in, keeping an eye on the time and wanting to take us forward, firstly to say thank you on behalf of Michelle and I and the team again, and also to say that we have in mind a follow-up webinar that we hope will be of interest, which takes you through more of these questions, more of the nitty-gritty around which studies answer which questions. And kind of just introduces more the principles of, what is credible evidence out there. So I hope we can engage further with you and find a time that works flexibly, that works for everyone to meet again.
That sounds great.
Okay, great. So thank you all. And also just thank you for all the incredible reporting and work that you're doing. It's very, very much appreciated. And yeah, good. I hope you can have a bit of a weekend, but otherwise we look forward to reading more about and from you in next week.
Thank you very much for your time. Yeah.
Thank you, guys. Thanks so much. Take care. All the best.
Thank you.
Bye.
Thank you.